Welcome back. Thanks for staying with us. The Rural Health Advocacy Project has welcomed the 28 billion rand health bailout National Treasury has allocated to navigate debt and the provision of health services over the next year. Despite being 5 billion rand below their allocation, they had hoped for. The advocacy group says the allocations will lay a foundation for the broader plan to strengthen public-funded health services going forward. Executive Director at the Rural Health Advocacy Project, Russell Rensburg, joins us now for more on this conversation. Russell, thank you so much for your time this evening here on SABC News. Now, you have welcomed the 28 billion rand allocation from the Health Minister. Just give us just overall your reaction as an advocacy group when it comes to the healthcare sector and the money which has been proposed for it.
Yeah, I think that was really unprecedented, at least in the last decade, for us to make the kind of investments in the health systems that we've made with this particular budget. You know, we haven't really had above inflation increases in healthcare since 2012. You know, over that time, we've had some spikes with spending on COVID and the like. But overall, our health systems are in a great shape. So I think the package of interventions or additions to the health budgets are actually quite good. It won't solve all our problems, but it will lay a foundations for us to better understand our problems and start prioritizing those areas that have the most urgent need.
There is a shortfall from what you had initially wanted. There's a shortfall of around 5 billion rand. Do you think that it's still enough to carry out some of the very important and crucial projects in the healthcare sector?
Look, I think the 5 billion that we sort of penciled in our back of the envelope calculations was around replacing the PEPFAR funding. You know, PEPFAR investments have contributed significantly to South Africa's response to HIV over the years. And over the last 10, 15 years, those programs have supported us in enrolling close to 5.5 million people on treatment. We also have very important targets going ahead, where we're looking to find, as a country, 1.1 million people who are HIV positive and know their status but are currently not on treatment. Those require investment. We have over 56,000 people who die from TB each year, a curable disease. Big campaigns are planned at the moment that require all the capacity that we have available in the health system to test over 5 million people for TB so that we can find TB early and reduce deaths. And I think there are a myriad of other district health type routine healthcare services like access to family planning, access to routine healthcare services and so forth that get strengthened by some of the proposals made in this budget. So yes, we have an opportunity now to start laying a foundation for a broader plan to strengthen public provision of healthcare services.
And earlier on, Russell, you mentioned PEPFAR funding, and of course, we now know that there is that shortfall of funds for very important programs looking at HIV and AIDS in the country, and looking at this healthcare budget. What then does it say to some of the money which has been cut by the US government, aiding very important projects in our country? Can this budget also then, address some of those shortfalls?
No, absolutely. I think at the moment, the current set of interventions lay the foundation to strengthen provincial healthcare provision by trying to fund some of the unfunded or accruals or deficits they have in their budget in the short term. And then the next set of negotiations that's happening at the moment is between the Department of Health, the National Treasury, on working on a plan to integrate some of those services that were previously funded by the American people. So I think that would be an additional allocation that will be added to the budget in the next couple of months and probably appear in the adjustments budget in October based on what information that we're receiving from sources within both those areas.
And
So yes, I think this budget is a step in the right direction.
Yeah, and just before we saw this budget being tabled, we also heard from some unions in the healthcare sector when it comes to addressing challenges of staff shortages and those kinds of issues, doctors who are at home, who are qualified, but because of budget shortfalls in the country, were told that are unable to, be roped into the healthcare sector. What do you have to say when it comes to the issues around staff shortages in our healthcare sector and this rhetoric that we continue to hear that there really isn't enough money in our budget to address all of the staff shortages we have in the country?
Look, I think, again, the budget takes a step in the right direction by allocating funding for employing 800 of the 1,800 unemployed healthcare workers, and that's a very good start. For us at the Rural Health Advocacy Project, because the distribution of HR in the healthcare system is so skewed towards large urban areas, that as we consider deploying these 800 workers, that we consider rural district hospitals and rural districts for priority for strengthening, because often these are the last ones to be filled. So if we're going to be adding these 800, we're suggesting the department goes through some kind of prioritization process through the development of an operational HRH plan and ensure that these posts are allocated to the areas where there's the greatest need. So like we said in our statement, is that we're very pleased that we're making these investments now. We understand that there's much broader issues within the healthcare system that needs to be funded. But as a first step towards strengthening the system, there are critical areas that need priority. And I think the ones proposed in the budget certainly are those.
All right, Russell, thank you so much for your time. That is Russell Rensburg. He is from the Rural Health Advocacy Project. He's the executive director there, welcoming that budget in the healthcare sector, also addressing some of those pains in which we saw from those in the healthcare sector. Of course, lambasting the issues around unemployed doctors, saying that they welcome the prioritization of those 800 personnel to the healthcare sector.